So we are now live, huh? Almost there. Yes, we are live now, Brother Ngong. Thank you so much for joining. And we are going to discuss about the disease called hepatitis. It's one of the diseases that we have been seeing in South Sudan, and most of the people are dying because of this disease. They don't know the disease, and the disease is really deadly. And some of the people, they don't know the causes of the disease and how disease originated until it affects the persons, and we don't even know the symptoms of the disease. Sometimes, most of the people, they don't know the symptoms, but some of the people, they need also to know the disease. They also need to know the symptom of that disease, and knowing of the symptom of the disease sometimes is very complex in another way around. And some of us, we are really trying to have a conversations with our people, like those of Ngong, even if they are out of network. So we are trying very hard, and that's why you always see, we always try, even if network is really very hard, we still try, because this is South Sudan, and we have to be realistic with it, and everything will be okay, of course, yes. If time comes, then the internet infrastructure is going to change. And that is the reasons I always bring to you some of the guests, and those guests, they are also South Sudanese, because they know everything here in South Sudan, and they know how our people are suffering. That's why I always intend to bring such type of intellectual in order for us to discuss some of the issues that we are facing in our community. It is too hot here in Juba, of course. You can see it is almost 30-some degrees. That is only the hotness. And there she ajib jidden. And you have been seeing this now. It is now hot. I'm even sweating, if I can tell you, because situation is so much hard for us to endure it, and if we endure it, we have to move forward. So I'm waiting for Brother Ngong to tune in so that we discuss the disease, which is hepatitis. Ngong is also one of the students in Egypt, and he is also qualified to tell us more about the disease, because this disease is deadly. Let me tell you, it's deadly, and it need to be counter a lot, and that's why I always try to discuss some of the disease that we are going through with, and we need to see how this disease affect the people, and also what could be done to prevent them, and after we prevent the disease, then what will come out from that. So that is why we are going to discuss today. And we were supposed to discuss with Brother Ngong, but he just went off. Maybe he might be suffering from the connections, but I think he's going to reconnect. He's going to come. And for our viewers also, if you know this disease, maybe you can make a comment, or you can ask the question. If you are a doctor, you can ask the question, then our Brother Ngong will answer that question, in case you have any question that you want to say. Or if you have any opinion, if you have any discussion that you want to, then you need also to text me, so that we arrange the time, and then we talk. We share the ideas, and that is the best part of it, because if you talk, and if you also share your ideas with your people, I think this is what South Sudan needs. South Sudan doesn't need us to keep quiet. If somebody knows something, then you have to bring it out to your people. Let them know that this is this and this is that. But if you keep quiet just in your compound, in your house, and you don't want to share anything that you know, sometimes it's bad. And we need you also to be realistic. We need you also to share. And when you share something that you know, maybe some of the people will also understand what you are sharing. is really a nice information, and some of the people will change automatically from what you say, and that is the best part always of learning, because when we learn, we happen to share things together, we move together, and we also stay together. And that is the reasons we are here today. Yes, Brother Ngong, I have been waiting for you. I'm sorry, maybe you have disconnect yourself because of one reason or another. We may understand that situation. So
Oh,
what
sure,
happened?
yeah.
What happened?
Oh. It was just network. It was network problem. I tried logging in, but it was not accepting.
Hey, okay.
And it's good and back now.
All right. That is great. That's great if you have come back, my brother.
Mm.
Yes. We, as we have been discussing these issues in our
Yeah.
society, we have hepatitis, and hepatitis sometimes is now a deadly disease. It is now killing a lot of people, and some of our people, they don't know this disease. It might be with someone, but after a while, after they go to treatment, or if they go to hospital, this is the moment they will find that they are suffering from this disease. But initially, they don't know that this disease exists, and this disease is deadly. I want you also to elaborate more on that. Why is this disease deadly like that, and what are the causes of this disease? If you can just elaborate it more. Thank you.
Thank you very much, my brother Coleman. I think if you have already shared it on Facebook, I guess by now there are people who are watching, because this is our target. As we're going to explain, we need to make sure that there are people who are paying attention to us, so that they benefit from this discussion. I would begin by introducing myself. Maybe some of the people may not be familiar with me. My name is Ngong Atem Akol. I am a final year student of medicine at Suez University, Egypt. I came here in 2021 and started in December of 2021 in the College of Medicine at Suez. Thank you. Today, we are going to mainly focus on the hepatitis. It's something we have already shared on media, and most of the people have already seen. To talk about hepatitis, the first and the most important thing that people should get familiar with is to know exactly what hepatitis is. After knowing what hepatitis is, we shall get into detail of pathophysiology, signs and symptoms, clinical manifestations, and the diagnosis, and who is at risk of hepatitis, the types of hepatitis too. These are all things that we are going to cover here today. And I'm going to begin with the definition. The simple breakdown of hepatitis is that hepatitis comes from the word hepatocyte. Hepato means the liver cells. And therefore, hepatitis is the inflammation of the liver. We all know what liver is. A liver is an organ, an internal organ that is important and performs multiple functions in our body. In a situation where liver is affected, the functions of the liver are compromised, and as a result, you become sick and you become a patient suffering from hepatitis. Here is the pathophysiology of hepatitis, how hepatitis comes about for your own understanding. Hepatitis, particularly the viral, we are going to start with the viral hepatitis, and hepatitis that is being caused by the virus. We understand that there are so many causes of hepatitis. Hepatitis can be caused by, there is a non-viral hepatitis that is caused by things like alcohol, autoimmune disease. But right now, I am going to begin with the viral hepatitis, and hepatitis caused by the virus, which is the most common one that our people need to learn and benefit from this. Beginning with the viral hepatitis and the pathophysiology, when a human being is exposed to the virus that causes hepatitis, definitely the virus will go to the liver. Once the virus is in the liver cells and the immune system will detect an antigen, will detect a foreign body that is inside him. And as a result, the immune system will react by producing what we call interleukins, or the fighting mechanisms that will make sure that the foreign body or the antigen that is detected in liver cells is eliminated. In the process of fighting the virus that is detected in the liver, the cells of the liver are affected and they're being destroyed. As a result, it will lead to fibrosis. This will also lead to cirrhosis, and in most cases, it becomes a liver cancer. This is the simple pathophysiology of hepatitis and how hepatitis comes about. Now, let's get deep into the type of viral hepatitis. What are the viruses? The viruses that cause hepatitis. We must have all heard about them. There is type A, hepatitis A virus, hepatitis B virus, hepatitis C, D, and E. I'm going to take you through them one by one. We will begin with hepatitis A. Hepatitis A, it is the type of liver disease that is caused by hepatitis A virus. The virus that causes hepatitis A is what we call hepatitis A virus. Hepatitis A virus is mostly got in fecal-oral route. This simply means that when you come into contact with the contaminated food and water, you are likely to get type A hepatitis. It is transmitted in a similar way as cholera and typhoid are transmitted. Once an infected person defecates openly, the virus will be carried by the water. And if someone who is healthy comes across that water and drink the water, you are likely to get hepatitis A virus. And then one good news about hepatitis A infection is that it's a self-limiting disease. It's a disease that without treatment, it can go away on its own. The immune system will be able to fight hepatitis A until it is cleared out of the blood. This is the most important thing that we need to know. Hepatitis A is a self-limiting disease that does not need any treatment. Once you are detected with hepatitis A, you cannot be given antivirals. There is no medical treatment given, but it's a conservative treatment where you are allowed to have enough rest, you have nutritional support, and all this. As a result, you will recover from hepatitis A. Let's come to hepatitis B. Hepatitis B, just as hepatitis C, it's one of the most dangerous types of hepatitis. Hepatitis B is mostly got from coming into contact with the blood of an infected person. This could be through sexual contact. This could be through childbirth, especially when the mother is infected. Then the child, during childbirth, is likely to get the infection too. These are the 2 or 3 main ways in which hepatitis B virus can be transmitted: through coming into contact with the blood by misuse of needles, the razor blades, and syringes in the hospitals, and through sexual contacts. It's actually a blood-borne disease that can only be transmitted through coming into contact with the blood. And like hepatitis A, hepatitis B infection is not a self-limiting disease like hepatitis A. It's a chronic form of hepatitis that may result to liver cirrhosis and lead to hepatocellular carcinoma, or the liver cancer in a simple term. Liver cancer is a complicated form of hepatitis B, or hepatitis B can lead to liver cancer, which is deadly. In most cases, it does not show any symptoms. There are no clinical manifestations of hepatitis B. And this is why we call it a silent killer. It's a thief of a human life that comes and only shows at the final stage when you are about to die. This simply tells that it is very, very much important to always screen for hepatitis B. And then another good news about hepatitis B virus infection is that there is vaccine for hepatitis B. It can be vaccinated. You can take the vaccines and therefore stay safe from hepatitis B. Yes, this is all about hepatitis B. Let's come to hepatitis C. Hepatitis C is transmitted just the same way as hepatitis B is transmitted. It is transmitted through coming into contact with the blood of an infected person, whether in the hospital, maybe during unsafe practices, where syringes are being shared among the patients, can be through sexual contact, just the same way as hepatitis B is transmitted. But what makes it unique is that there is no vaccine for hepatitis C. There is no vaccine for hepatitis C. It's a very important point that each one of us must take from here. Okay. Hepatitis C, just, oh, you have a question?
No, I don't have questions. Just proceed.
Okay. Hepatitis C, just like hepatitis B, does not mostly present, there are no clinical manifestations that present unless it has gone up to the final stage, the stage where it has already done an irreversible damages in the body, damages that cannot be reversed by medical treatment. And then second most important information to take about hepatitis C is that it can be treated only if it is detected early. Then how do you detect hepatitis C? There are no symptoms. There are no clinical manifestations that shows up when you have an infection of hepatitis C. The only way is to make sure that you go for screening, whether you are complaining or not. Always go for a medical checkup. Screen all types of hepatitis. Once you come across hepatitis C, it will be treated because it is curable. There is a treatment for hepatitis C, and like hepatitis B can only be controlled, but cannot be cured fully. This is another important information. You cannot fully cure hepatitis B, but you can fully cure hepatitis C. This is the difference. They all present differently, but the mode of transmission is the same because both of them are blood-borne viruses that stays in the blood and can only be transmitted to another person by coming into contact with the blood. This is it. Coming to hepatitis D, it's sometimes we call it super infection. It is an infection that comes when you already have an hepatitis B. You cannot have an hepatitis D separately. A patient that presents with hepatitis D, it's someone that is already having hepatitis B. And therefore, it is rare mostly. It's one of the rare type of hepatitis that is mostly not reported in most of the hospitals. So it's just a complicated form of hepatitis B. And it can be prevented by the vaccination of hepatitis B. If hepatitis B is prevented, or if you are vaccinated against hepatitis B, then you are likely not to get hepatitis D. Coming to hepatitis E, mostly it's just the same as hepatitis A. The mode of transmission is fecal-oral, meaning that you can get it through contaminated food or water, especially when the infected person defecate openly in the environment, and water carry the feces that contain the virus, and you come across that water, you are likely to get either hepatitis E or hepatitis A. E is mostly common in pregnant women. And this is important point that I need to emphasize on. Pregnant mothers must always be screened on hepatitis E, particularly because it is deadly with the pregnant mothers. This is the most common types of hepatitis that present with the pregnant mothers. Hepatitis E, just the same as hepatitis A. The general overview I would like to make is this: it's hepatitis C and B that are the most dangerous one. Why? Because they are bloodborne and they are likely to result or to lead to the liver failure or liver cancer. So the most common cause of liver cancer today in Africa is hepatitis B, and followed by C, together with other infection that causes the problem with the liver. This is all of the types of the viral hepatitis, actually. And before I proceed, I would like to get some few questions from either you or those who are listening. Thank you.
Okay, thank you so much, Brother Ngong, for this wonderful elaboration. I think you have really elaborated more about this disease called hepatitis, and I know that our community and our society is really suffering from this disease, and this disease is deadly, indeed, as you said. And I didn't know that it has too much division like that, to have E, A, B, and C, even D. I thought it is even just one hepatitis, okay? But I didn't know it has all this. You know, this disease is really deadly, and there is one thing that I also want to understand from you, and maybe you can just tell me. You might be, sometimes it is rare to understand that you are suffering from hepatitis. I want to know the major symptom. I mean, the symptom that when you suffer from that symptom, or when you detect the symptom, then you may know that you are suffering from this disease, because this disease now is deadly. And I really wonder, sometime you may find somebody you are staying with, and then tomorrow or after 2 days, you may find that somebody is dead. And when they go for medical checkup, you see, when the body is taken for medical checkup, some doctors and health professionals will say that this person was suffering from hepatitis. You know, I even wonder, and I don't know what type of symptom that is really showing, that is signaling that this is a hepatitis. And do those hepatitis, those divisions A and B and C, do they have also different symptoms, or they just have only one symptom? And what major threat is there among this division of hepatitis? Is there any hepatitis which is really very bad? And you also divide them into two categories, like we have non-virals and we have a viral. So do those A, B, C fall on non-virals, or they fall in virals hepatitis? So thank you. I think you can just elaborate on this.
Okay, yeah, thank you. I got your point. You are actually asking so that I emphasize more on the symptoms, the signs, and the clinical manifestation, how one actually knows that you might be having hepatitis because of A, B, and C. Generally, I will give the general symptoms of hepatitis, but these symptoms does not present in some types of hepatitis. This is an exception that should go with each one of you who is listening here. Jaundice in Tongmonjang, sometimes we call it gargan. The gargan, something like that, yes. Jaundice is one clinical manifestation of hepatitis. You can have malaise, the feeling of malaise, where you feel general body weakness. Let me put it that way. The feeling of general body weakness. You can be fatigued, feeling tired most of the time. Jaundice, it mostly presents with the yellowy discoloration of the skin and the mucous membrane, especially the eye, the inner part of the eye. This presents as yellow in color. And as a result, you can ask for a screening of hepatitis when you're presenting with such symptoms. But still there is this exception. Something that's exceptional here is that hepatitis C and B does not mostly present with any symptom in most cases. We call them asymptomatic. That simply means that they present without symptoms. You will only know them when they reach the final stage, the stage that it's about to kill. This is where you will be able to figure out some clinical manifestation of hepatitis. But generally, most of them do not present with the symptoms. And if there are few symptoms that each one of you should know, is the fatigue, feeling tired, the lack of hepatitis E, fatigue, and the feeling of malaise in most cases. So this is it. Coming to whether these types of from A, B, C, D, and E falls under viral or non-viral. No, these are viral. What we call A, B, C, and D are all the viruses. And I said earlier that hepatitis A is the disease, but that disease is caused by a virus called hepatitis A virus. So hepatitis A virus is a virus that causes hepatitis A disease. You see, the same as hepatitis B virus causes hepatitis B. C virus causes hepatitis C. So these are the viral causes of hepatitis. We've not touched the non-viral causes or non-infectious causes of hepatitis. This will be the second part of our session. But right now, we're just focusing on the viral causes of hepatitis. The most important information that people should get to know is that you cannot, there are no symptoms that will show so that you understand you have hepatitis, whether you have A, B, C, D, or something like that. No. You must always go for screening. This is the most important thing. You just have to make sure that you go for checkup, whether you are sick or not. Go for screening to check that you are free from any type of hepatitis. And hepatitis C is actually the most dangerous form of hepatitis, especially the viral causes, because yes, there is a treatment for it, but there is no vaccination. Given the fact that it does not show any symptoms, you never know you have hepatitis B or C, unless you go for checkup accidentally and find it out on your own. So this is it, and yeah. I think if there is another question, I will be ready to answer that.
Okay. Thank you so much, brother Ngong. You have really elaborated more, and I was confused to find out this disease called hepatitis, and I came to know it, of course, as I told you earlier, that you may stay with somebody today, and then tomorrow you may find that the person is dead, and when they go for checkup, they will find that maybe there is something happening. There is also a disease that you have mentioned. That disease, it is common also to South Sudanese. It's called gargan, as you said. Gargana is in Arabic, maybe it's in simple Arabic, but maybe it is there also in another Arabic language. This is the Sudanese Arabic, of course, yes. And this disease, it has really stayed. Since I was young, I've been listening to this disease, and it is deadly, of course, yeah. And sometimes it cannot appear after 2 to 3 days. This is the time that it appears. And when you are injected with any drugs, okay, let's say malaria or any other thing, okay, you may seem to die, brother. I don't know what type of this disease, Dr. Ngong. And you have also said now it is one of the hepatitis, okay, it's one of the viruses as well. And we have traditional medicine for this. Sometimes you may be given, there are things that should be given to you. I don't know. I've just forgotten those things. So they will be given to you, and you will just swallow them. So I don't know what is this disease. Does it have connections also with hepatitis?
Oh, okay. I want to make this clear. Jaundice au Gargan is actually not a disease, and I will make you understand this. It is not a disease on its own. It's something happening within your body. Are you getting me? Jaundice, in simple, I don't know how I will explain it for you to understand, because it will look more scientific rather than just an health awareness.
No problem.
Explain it this way. But let me try. Jaundice mostly. Okay. Jaundice is not a disease. Jaundice is a clinical manifestation of hepatitis. Why? In the body, we have red blood cells. I hope you will not get confused somewhere here. We have red blood cells. These red cells, once they've been in use for long, they will be broken down in the body. As they are broken down in the body, especially in the spleen, we have what we so-called bilirubin. Bilirubin is a product of the red cells being broken down. They all age, because red blood cell can also age. If it is broken down in the body, the bilirubin will be moved to the liver. If the liver is not functioning well, that bilirubin will be secreted to the blood. And this is what manifests on the body. This is what shows the yellowy discoloration on the skin and sometimes in the eye. And this is what we call jaundice. Why does it happen that way? It is the function of the liver to make sure that bilirubin is metabolized, is being broken down in the liver, and then is used as the bile that help in the digestion of foods. Because liver also help in the digestion of food. There is a bile that's being produced by the liver that is being ejected into the duodenum, the part of the intestine, to help in digestion. In this case, if liver is not functioning well, the bilirubin that is being produced from the red blood cell, the old age red blood cell, does not get metabolized well. And as a result, it will be secreted to the blood, and it will manifest on the skin as a clinical manifestation of the conditions that has broken down the red cells in the body. It can happen in the cases of hemolysis. Hemolysis is where red blood cells are broken down in the body to produce this product. So jaundice is not a disease, but a clinical manifestation of another condition that involved liver in the body. Any disease that involved liver in the body will always present with a jaundice, but jaundice itself is not a disease on its own. I hope you understand this.
Yes, indeed, I understood. Yeah, I understood the scientific behind all this. I really understand now. But I thought this was a disease that's always, it killed people indeed. Yeah, and I know that now it is related to biles and pancreas and so forth. So I understand that this clinical manifestation is really, it shows a critical sign, and when these symptoms appear, make sure that you are in danger, your life is in threat. So you need to check up, you need to do all this. Dr. Ngong, I have some observations in South Sudan and in regard to this disease called hepatitis. So in South Sudan, I want to know what type of hepatitis is really a major threat in South Sudan, because as you said, we have many type of hepatitis, but and then they might be different. I want to know also if all these diseases are in South Sudan, and which disease is really deadly in South Sudan, because and as I told you earlier, that you might be staying with somebody and then tomorrow this guy is like this and this is what happened. So we need to take care of ourselves. And if there is a disease, if there is a type of hepatitis which is really deadly, then you need also to tell us that this type is the one that is deadly. And we also encourage our people to go for checkup. So all these things are basic requirement for us, and our people should also understand that making checkup is not something that you have to take it slightly, but it is really your health, and it is very important for you to check for your medical status, because if you don't check up, maybe you might be having a disease that will just ruin itself into your body, and maybe it will kill you. So you don't know what is inside you there, but if they are attacked by outside threat, they are easily to be attacked, and they are easily to die. And that is the problem that we always encourage people to go for medical checkup, because it is really necessary for all of us. And Brother Ngong, I want to understand exactly what type of hepatitis is deadly in South Sudan.
Okay, yeah, thanks for this question. I will make it simple this way. Just as I said in my explanation earlier, that there are different forms of viral hepatitis, beginning from A up to E. I will put them into two: hepatitis A and hepatitis E are self-limiting infections. What does it mean? It means you can get an infection, and then your immune system will be able to clear out the infection on its own without taking the treatment. But there is an exception. In hepatitis E, because it mostly affects pregnant mothers, it must be handled with a good care from the doctor. Otherwise, it may end up killing the mother, because it is very common in pregnant mothers. This is the only exception that is there in hepatitis A and E, because they all present with the same manifestation, and the mode of transmission is the same, which is fecal-oral, which means that you come across contaminated food or water being infected by the feces of an infected person. This is it. Hepatitis E and A are self-limiting infections that our body can clear on their own. Now we're remaining on the three: B, C, and D, which I said clearly that D is the super infection of hepatitis B. This means that if you have an hepatitis B, or let's say someone who have an hepatitis D must be first infected with hepatitis B. This means if you have hepatitis B, then you will develop hepatitis D. And this is why we call it as a complicated form of hepatitis B. What we consider as the most dangerous types of hepatitis, especially the viral hepatitis, is B and C. And the worst one is C, because B can be vaccinated, but there is no vaccine for hepatitis C. So hepatitis B and C are the worst form of viral hepatitis. And these two do not have clinical manifestations. They do not show up. You will only find them if you go for a screening, because they are the chronic form of hepatitis. They can stay with you for a long period of time. So the simple answer is that hepatitis B and C are the most dangerous form of viral hepatitis. Thank you.
Yes, Brother Ngong, thank you so much for educating us in this disease. And I think you really have information about all this. And this is a great thing, of course. And that is the best part of being intellectual. And that is the best part also of being professionals. This is a great thing. We have a question right here. A question from one of our viewers is asking a question. He's saying that he's asking, can people get hepatitis E from animal meat and how? This is the question that he asked. He asked that, can people get hepatitis E?
Can you repeat the question?
Yeah, he said that, can people get hepatitis E from animal meat, and how do people get this also from animal? I think you have understood the question.
Yes, I understand the question. Can people get
okay, Brother Ngong. Now, if you understood the questions, as a Nilotic, like Dinka and Nuer, these people, they always associate themselves with cows and cattle. So, okay, let's say cattle. And they always eat cows, okay? And you cannot stay like 2 to 3 days, or let's say 1 month without eating meat of the cow. If this disease is there, if people get it from cow, indeed, this is the question that this guy is asking. Because if people get it from cow, then does it mean that we are going to leave rearing cows or what? Or can we stop eating meat? If that this is what I heard also from science or from doctors. Sometimes they will prevent you from something that it is danger, and almost everything is a disease. Even water, if you drink too much water, is a disease. If you eat too much, is also a disease. Okay? And if you run very fast, is a disease. Anything you do, it is a disease. I don't know why. Can we leave eating meat, or what is that? I think this is what this guy is asking for. Thank you.
Okay, the simple answer to whether you can get the hepatitis E through eating meat. Well, the simple answer I can give here is no. The fresh meat that is not being touched by an infected person with hepatitis A or E cannot cause hepatitis. This is the simple answer I can give. You cannot get it from a fresh meat unless the meat you're eating is being touched by someone who has hepatitis A or hepatitis E. Yes.
Okay. Thank you. This is a good answer, by the way. I appreciate that. Now, Brother Ngong, I'm also coming up with another question, and this question is why do many people live with hepatitis for years without knowing it? Because you may be living with the hepatitis, but you don't know that you are living with it. And this raises up a concern of like, for example, if you have hepatitis and you don't see any symptom, and what human being is afraid of is to have clinical manifestations, is to have a reaction from the body. This is the moment you will know that you are sick. But if you are not sick, if there is anything that is training, if there is anything that is happening, then you have to stay. There is no problem that you bother yourself. There are some of the diseases that are with people until somebody die. But if they go to hospital or let's say clinic, sometimes they will be told, and if they are told, they will have that trauma, and then they will panic. Somebody will die even from the disease, and I don't know if hepatitis is really a kind of that disease. Why do many people live with this disease indeed for years without knowing them?
Yeah, thank you for this question. This is a good one, and I hope people will take something from here. Hepatitis E, hepatitis B and C, and D too. These are the chronic form of viral hepatitis. What does it mean when I say chronic? Chronic means that you can live with the infection for a very long period of time. There is what we call carrier. You can be a carrier of the disease when you have a disease in you, but it is not manifesting. It is not manifesting, but you can transmit it to others. Yet there is no manifestation. There's no clinical manifestation that's showing in you that you have this disease. So hepatitis hepatitis C and B are chronic form of viral hepatitis that can live with someone for a very long period of time. And if not detected early, they will result to a complicated form of the hepatitis. And this could be cancer, a liver cancer that is so much deadly. With hepatitis, you cannot just die unless it has reached the end stage. End stage is when liver is totally broken down and is not working. The liver has become cirrhosed, and as a result, there is a cancer in the liver cells. In a situation where there is a cancer in the liver cell, definitely you will die. At that stage, you cannot treat it in any way. It can never be treated again at that stage. So the simple message that this person, the person who asked this question, should go with is that the only way is to make sure that you do screening. Do screening, find out whether you have hepatitis or not. If you have an hepatitis, then you will see a way you can control it. Because hepatitis can be controlled. Hepatitis B can be controlled. A control means that the proliferations of the virus in the body is suppressed, is stopped as you are taking the drug. It's being suppressed. And as a result, you will live a normal life if you are making sure that you take the drugs, antiviral drugs, and you're also following up with the doctors with the modified living styles. You don't take drugs that are hepatotoxics that cause a problem in the liver, the overdose of the paracetamols. You have to make sure you reduce it, and some other important things. So this is the simple answer I can give. Thank you.
Okay, brother Ngong. You have really said something very nice, and I think staying with this disease for years is really chronic indeed, and this is what results into the cancer sometime. And you may wonder, how do you get cancer? And so, and some of our people now die because of these diseases. And I think cancer is a demolishing of the cells in your body, maybe, and our body is made up of cells in this. And if these cells are attacked and they are dead, make sure that your probability to live long is really less. It's not that much. And that is why we need to take care also in those viral disease, because they are really threatening. Except bacterial disease, somehow they are okay. But viral diseases are really very hard. And if they attack you, they are really chronic, and they may even make you suffer a lot. Now, Brother Ngong, I have simple questions, and I think how does poverty, let's say here in South Sudan, or people live in poverty? So, and the poverty is really alarming here in South Sudan. So you can see that our people are suffering, and some people, they don't get clean water. Some people also struggle to go to hospitals. Maybe if you are staying in Torit, maybe you'll walk from Shukudum. Going up to Torit is really very far. Maybe there is no transportation, and maybe there are no drugs also in that place. And now maybe you just go to the hospital, maybe you'll not get anything. So how does poverty contribute also, and the lack of clean drinking water and the weak health system that is here in South Sudan? How does all this increase the risk of hepatitis and some of the disease that we are seeing? Because when we see now in our country, the health system is really weak. That's why we always seek to go outside the country so that we will also seek for medical condition. Medical attention to those who are professional in the field, and also to some of the hospitals, of course, yes. And when we see, of course, it really take time. And if you don't have money, Brother Ngong, maybe you will just die because of a simple disease that you may treat. But because you don't have anything to treat the disease, maybe you will just die, and nobody is with you, nobody is care. And if you die, you die. If you don't die, you just live. So all this, our society is suffering. And if our society is suffering, what are your advice that you want to give them, seeing they don't have money to go for checkup? Because if you go for checkup, it also need money to pay. If you want to go for checkup, you can also mind those who are also staying in the rural areas. These people also, they need to be told, because for them to take the journey from where they are to the town, sometimes it take a lot of time. And if it take a lot of time, it mean that it's really very hard for them to go to those places. These people, they also need advice. And it doesn't mean hepatitis it also attack those who are in town, but also those who are in village. It also attack them, because seeing they are human beings, so they must also get this disease. And I don't know, what are your advice that you want to give to these people, because they are now listening. Some of them are listening while they are in the houses, and some of the people in the town, maybe this one is what the God sends. But people in the village, exactly, they need to listen to all this advice, so that they always take care of themselves, and they live with themselves until the age, until their time comes, and then they go, and then the other generation will come. So what is your advice to them? Thank you.
Thank you very much. This is a good question. Yes, poverty mostly is connected to some of the diseases. I can say there are diseases that are more common in areas with low socio-economic status, areas where people do not have access to clean water, and areas where you do not have access to clean food. You are likely to get infected with diseases that are connected to dirty water or contaminated water. I would say, let's say if you live in a town, a clean town, where you don't come across dirty water, there are these diseases that you will never get, or chances of you getting them will be reduced. Infection like malaria, you cannot get it if you stay in a place where there are no dirty water, where there is no environment that will host the malaria parasites, the mosquito, So poverty is one contributing factor to why most of our people today have these infections that are connected to dirty water and dirty foods and the environment itself. The only way is to make sure that we try what we can to prevent such infections. Yes, I know it's hard. It's hard because by the end of the day, there is nothing you can do. You cannot access clean water. Maybe in your area, you do not have, like, let's say, a borehole that sometimes, water you get from borehole may not be that clean, but better sometimes if you warm it for a while and then, drink it, it can be better, can be free from infections. But some of the communities, most of our communities, they do not have access to such water. And as a result, infection will always be there. My advice is that always go for a checkup. Know that with taking dirty water, you are likely to get this disease and this disease. And as a result, you must always be screened so that you confirm whether you are free from infection or not. The whole of South Sudan in Africa is a country of the lowest socio-economic state. And this is why we have such multiple infections in the country, infections that are connected to a state with low socio-economic status. So the diseases are there, the mode of transmissions are always there, and people mostly get infected. But I advise people not to delay to seek for medical attention. Whether you have a complaint or not, just know there are diseases that does not mostly present, that wait until they reach a stage that is not good with your health to present. So this is my advice. Thank you.
Okay, thank you, Brother Ngong, for all this. And I think our people have really understood what you said, and that is good, of course, yes, to have a doctor. And Brother Ngong, for us to come to the end of the program, I think we have people. We have our people in rural areas. These people, sometime you might be getting somebody is opening up a clinic, okay, in those areas, and somebody doesn't have even experience in health. And sometimes you may find them that they are the one now taking charge of all these things. In some time, when you go to them for checkup and do those medical checkups, sometimes they will tell you that you are now suffering from this disease, and if you accept that you are suffering exactly from this disease, then they will give you a drug. And this drug, sometimes you may take it, and then if you take it, maybe you will die, because there are some drugs that can kill instantly when you take them, if they are not prescribed for a certain disease. And I don't know that prescriptions indeed from some of the doctors and some of the health professionals. And I don't know why are people faking all this life like that. And I don't know, what do you say to these people? Sometimes you will not get them in town, because in town you might be having a government. Government might be running after them. And if government run after them, it means government is looking for license. And that's why some of you go to internship, you will be given a certificate. You will be given also certificate from the recognized institution that you are a health professional. And all these, they are really very important indeed, yes. But at some point, when you go to rural areas, exactly where there is no government having access to this, you may find that anybody like me, if I did computer science, or I'm a teacher, professional teacher, then I will just go and open up my clinic, and I will be starting treating people. And if there is any disease, then I will just say this is malaria, this is typhoid. Okay, but I don't know any other disease that is, some of the diseases might be there, but I don't know them. But I only focus in malaria and typhoid. In South Sudan, we have these people, and these people now, our people are dying because of this. There's no medical awareness being done. And there is one thing that I got when I was in Khartoum. Like when you graduate from university, then you will, as a team, as a batch, there's a time that you will go to make a medical awareness to people in the rural areas. Sometimes all these things are there. You go and aware people about health and about some of the diseases that are deadly. So I don't know. This thing is not even here in Juba. I don't see this thing. And our people are dying in rural areas nowadays. They are being killed by those who are not professional, those who did not even go to university, those who have never even studied medicine. These people are killing people, and I don't know, what do you want to say to these people?
Okay, yeah, thank you. Your question, I understand your question actually. Well, at home, the first thing I can say, the right answer to give here is that this is the role of the Ministry of Health. The National Ministry of Health of South Sudan must make sure that those who are practicing medicine, those who are outside there in the hospitals giving drug, dealing with patients, must be people with a license, must be people who are licensed by the Ministry of Health of South Sudan. And if they're not licensed, they should not practice medicine, because someone who do not have a license have no right to prescribe the drug. Just like me right now here, I have no right to prescribe a drug to anyone. Even if I think I know, I cannot do that. Because if I do it, I'm risking my life. Because whatever thing that will happen to the patient will be my responsibility. And this is what is mostly being stressed a lot in medical ethics. If you study medical ethics, you will know that unless you are authorized, if you are not authorized to practice medicine, do not temper to prescribe any drug, do not temper to diagnose someone based on the clinical presentation, just as our people are doing at home. You come complaining of headache, fever, body pain, and then you be like, this is malaria. Forgetting that there are a lot of diseases that present with these same symptoms. And the only thing you can do here is to make sure that you order the lab tests. Lab tests will help you confirm that this is this disease, this is this disease. If there are no tests done, you cannot make a clinical diagnosis based on the symptoms that you see. Many diseases, multiple diseases, present with the same symptoms, and this is why you must always ask the patient to go for the lab check. This will give you direction, will give you knowledge on what this disease is and how you are going to tackle it. So our Ministry of Health must make sure that people who are out there practicing medicine are those who have license, those who have done the training, those who have taken 5 years of studies in the college, or those who have taken paramedical courses. In East Africa, there is what we call CEO. I don't know, this is a title given to someone who has started a clinical medicine for 3 years, something like that, or diploma. You see, such people, depending on what our health policy say, these are the right people to deal with medicine, how to treat people, but not just anyone. Anyone who think like, yes, medicine is easy, I know this drug is used for this, and then you end up giving it to the patient. No, this is not right. If I come home today, I will not start straight away, like opening my own clinic and start working, treating the patient. No, I'll have to take my time, training in Juba Teaching Hospital, making sure that I've taken 1.5 years training, depending on the period of training. Then after that, after having secured my license, this is where I will be able to go out there and practice. Because if I commit a mistake, if I commit a medical error, I will be held accountable. And my license will be there with me if it's the case that is taking me to court. But right now, it's not happening at home. You'll find anyone from nowhere just giving medicine anyhow. Oh, this is malaria, this is typhoid, take this, it will be okay. No, it will not. The most and the first important thing, before even establishing a clinic, you must make sure that you have lab. Lab is the most important thing that you must first build, equip it, and then come with the pharmacy and go and work as a doctor. Yes, because lab will always give you direction on how you're going to make the treatment. So this is what I can say. It's just upon our Ministry of Health, actually. All I can say is that if you one of these people, just stay away, except that you're not capable to practice medicine. Or else go for studies, and then come and continue. No problem. But without a license, never try. This the advice I can give. Thank you.
Okay, thank you so much, Brother Ngong. Indeed, yes, you have really elaborated more about this. There is one thing that I mean, there is a question here, and this question is asked by one of our followers. Is asking about the viral hepatitis disease. This disease. So he's saying, is viral hepatitis disease transmitted through saliva or from death cases, or sweat, tears, or vomit from an infected person? If these people, I mean, if a person has vomit maybe you come across this moment, and if you kiss somebody and also sweats of somebody, or let's say tears also, all these areas that you may get this viral disease. This is the question he asks, and he's serious about this, of course.
Okay. I hope he's listening. Yeah, I can say yes. You can get hepatitis B and hepatitis C through the sweat of an infected person. The body fluid that come out from an infected person can transmit the disease to another person. So the simple answer is yes, body fluid can transmit the infection, particularly the hepatitis hepatitis C and hepatitis B. Yes.
Okay, thank you. I think he's also listening. Brother Ngong, we are coming to the end of the program, and I think we are now winding up. And for us to wind up this program, it has really been a good program. We are now 1 hour and 8 minutes, and it is really good conversations, and you have really shared your experience and also what you learn. You also share them, and this is a great thing, of course, yes, because being a medical professional, you need to be good also to present things in a way that, or in a way that also your client can understand what you say, because it is necessary. Your client may be suffering from something, and if you don't have that habit of communication, sometimes your client may die in front of you. Maybe your client is having something deeply that needs you to bring out. But if you are not good in speaking, sometimes your client may die. And this is not what you are trained for. Because being a doctor, sometimes you always stay for someone. You always have empathy about the suffering of the other people. It means you have sacrificed your life for other people to live rather than you to live. This is the first thing in medic. And if it is the first thing in medic, we have been seeing today that there are health professionals that also, if you go to them, I don't know if we connect it also with emotion, because people have different emotion. And when I go to some of the doctors, sometimes I may find them, there are some of the doctors, even if you talk to them, Brother Ngong, so they will just treat you like they are not even listening to you. And somebody is not even taking care of you, okay? But I don't know what type of what type of health profession is this, because your client is here, and if your client is there, I mean the patient. So you need to treat the patient because you have empathy, and that is the reason you are trained for. You are not trained for any other thing. You are trained for the patient, so that patient can live. And if something is taking your life and patient is alive, this is the role models of the doctors. I know this. Okay? You may even risk your life because of other person to live. Okay, but if the patient is in front of you and you are not even taking care of them, are we going to connect it also with emotion? Can we tell people who have those short emotions, those who react innocently? Okay? Can we tell them not to do medicines, or what are we supposed to tell them? Because when you talk to them, it may seem that you are doing something bad. But sometimes, being a doctor, you need also to open up yourself and allow everything to happen. Even if patient is there insulting you or is doing any other thing, so make sure patient is patient. But that's why he came to you. You need to listen to them. But some of the medical professionals, they don't have this. They don't have this spirit. And I don't know what you want to tell them, because maybe they may be listening to you, and they want also to know. If you tell them, maybe they will listen. You also have nurse, because I'm generalizing it. But you guys, you have that divisions of having a doctor, a nurse, CEO, and all this. But nurses and let's say the general medicine, people always make themselves like they don't want to take care of you. Sometimes if you come to them, they will just feel they don't want even to talk to you. Somebody will ask you and say, "What happened to you?" And then they will not proceed. So this type of communication is it good also to have as a medical profession, Brother Ngong, or what is going on? Thank you.
Oh yeah, thank you very much. Yani, Taban, if if we talk about medicine in particular, especially the doctors, being a doctor is not just about studying in class, passing the books, the biochemistry, anatomy, physiology, histology, and all this. No, this is not it. Medicine is more of your personality. This is what I can say. It is more of your personality in a way that if you are not kind enough, if you're not someone who's kind, then you'll have problems. Because if we look at a doctor is someone who deal with almost more than 50 people a day, depending on the work, depending on your specialty, where you're working on. Let me say, you may be having a lot of patients in a day, and these people who are visiting you in your clinic, they are people of different personalities. Some people talk anyhow. Some people say anything that's in their mind. Some people will even question your qualification. If you ask them trying to take history, you may be irritated by what the patient is saying, even a lot of things. As a result, you need to be someone who's calm. You need to be someone, whatever thing that patient say, just observe it with you, take it as a normal thing. Be kind to that patient to make sure that the life of the patient is your responsibility. And therefore, for this patient to live and to walk again as a normal person is your responsibility, regardless of what they do. You see, you can be dealing with psychiatric patient. If you're a psychiatrist, patient, you may even end up being boxed by the patient. Patient may come while fighting, pick something from the ground, hit on you. What will you do if you are a doctor? So if you're someone who is emotional, and you'll be like, okay, you go and be treated by your family. From there, you are not dealing with the patient in the right way. So being a doctor means that you are sacrificing most of the things. You are sacrificing your time and your emotion. You have to control. You have to be kind enough. This is the most important thing. You have to be that person who is willing to help, whether you are asked or not. You have to be willing to help. Because patient who is sick brought to your clinic, make sure that it's under your care. Just like your child, you can do anything to your child. If your child cries, you have to make sure that you stop the child from crying by doing anything good that will convince the child to stop from crying. So this is how people need to be treating the patient. Patients are not our enemies. No matter how much they react to how we do things or all this, they're not our enemies. There are people who come and get the treatment. There is this saying that another thing that I would like to add here is that the saying goes, a patient is not your client or is not your customer. What does this one mean? That a patient is not your customer. Your customer, just like you're selling things right now. There are things you do and you sell them sometime, right? You will make sure that the person who come today must come back again tomorrow and sell from you, right? You'll have to make sure that you do things in a good way so that they come back again tomorrow. But in the field of medicine, a patient is not your customer, because when you receive a patient today, you have to treat that patient to be free from that infection and never expect that patient to come back, because you have treated the disease fully and you pray it gets better and does not come back again to you. Not like in a business where you are selling sugar. You will expect the same person to come and buy from you every day. So a patient is not your customer, because right now at home, there are doctors who even do it intentionally. If there are limited drugs in the clinic, you will end up giving a dosage that is not enough. A dosage that will not clear up the disease, the infection of the patient. And as a result, the patient will come back 2 weeks, 3 weeks later, complaining of the same thing. Why? Because you're failure as a doctor. The drugs or the dosage you've given was not enough to clear up the infection. So some of all these are being done by unethical doctors who are practicing medicine today. So all I can say is that a doctor must be someone who is kind. A doctor must be good to everyone. A doctor must be social. A doctor must be someone who do not see people as problems. Like you say, these people from this community, I have problem with them. I have problem with these people. No, they will not trust you. Or even if they trust you, inside you with the hatred that you have toward them, you will not do well to them. You will not perform what's needed, the medical attention that you're supposed to give them. No. So a doctor must be someone who is actually perfect, let me say. Because if you are not perfect in any way and make mistakes, then you are killing people. Mistake in medicine costs life. You see? So medicine is a lot. There are a lot of things actually. Yeah, shukran.
Thank you so much, Brother Ngong. Now, Brother Ngong, we are coming to the end of the program, and I think we have really narrated a lot of things, and the general medics, and also the hepatitis, and the way that it the way that it attack people, and the way that also it can kill, and some of the symptoms that you have also elaborated. All these things are crucial, and they are very important as South Sudanese. We need also to take care of ourselves. Since our country is suffering from poverty, and also we have economic crisis, and we also have families outside Juba, because Juba is one of the largest cities in South Sudan, followed by Wau, followed by Malakal. So all these places, I think you may not get disease easily, because you just come to the town and everything could be done and your life will be rich. But exactly to those who are living out there in deep village, so we need to pass our regard to them that you need to take care of your health. Otherwise, you just need to take some time. Maybe you take like 3 months, or let's say 1 year, and you go for medical checkup. It's necessary for that. Just to spend 1 year, and then after 1 year, you go for medical checkup. Even if you are not even getting pain, even if you are not even feeling something, you need to go and make some checkup, so that you will also see your body, how is it, and what is going on in your body. And this is how it is. Brother Ngong, as we are coming to the end of the program, I think I want to give you just only 2 minutes or 3 minutes to say the final word to our viewers, and also give some appreciation also to Akol Podcast for also giving these platforms as the voice of the innovation, in a way that you also share your opinion, because some of the people might be looking for this advice, some people might be looking for all this, and they don't get them. But through this Akol Podcast as the voice of the innovation, some of the people have got also a benefit of listening to the current status, and also health, educations, and also our social status. So all these people, they are now watching you, some of the people. And I also get a lot of comments. I got a lot of message also in my inbox. The people always feel happy when they see such a content, because this content are really educative, and they also help you to live a healthy life. So that's why I'm bringing you as a professional doctor also to say something of this. And I want you to say the final word just in 3 minutes or two, so that we wind up the program. Thank you, Dr. Ngong. Welcome.
Okay, thank you very much, Brother Akol again. I think based on what we were supposed to discuss all, and this is why I was saying the topic of hepatitis is really wide enough, and to emphasize on it all cannot be done within 1 hour. And up to now, we have only emphasized on the viral hepatitis only, leaving behind the non-infectious or the non-viral hepatitis, which is also another big topic that can be discussed on its own day. There's no problem with that. It's because of time, and we're not going to extend this. It's because I'm also going to have another important thing by Sahar Bonus. Right here, I will say thank you very much, brother, for always coming up with these ideas of hosting us, especially the medical personnel, to make sure that we give some health tips and awareness to our vulnerable population out there, because these are the important information that they need. You must be medically informed whether you are a health personnel or not. You have to have some knowledge on your health. Otherwise, you will not lead a healthy life. The little information I'll give out to the people concerning what we discussed today about the viral hepatitis is that hepatitis can be prevented, and this is the most important thing. there is always a saying that prevention is better than cure. If there is a way you can prevent something, then you prevent it. Make sure that you stay away from it. So hepatitis is a preventable disease. Hepatitis can also be treated, can be cured, depending on the time, depending on when you realize that you have hepatitis. If you go for a checkup regularly and find out that you have the virus in you, but it has not done anything in the liver, it has not damaged the liver, then it will be treated and cured. The most important takeaway message is that always go for a checkup. Always go and confirm that you are healthy. That's very important. I understand I am a South Sudanese. I know, and it's something I experienced. I will tell a story in some seconds. Back then, when I was starting in South Sudan Education Center at the Will, there was a program that was brought by, was it UNIMIS or Will Health Hospital, the civil hospital, I mean. The program was to make sure that young people are all tested for hepatitis and HIV and AIDS infections. By that time, we all do it. Why? Because we didn't want to go and have the stress, like after finding out that, yes, you have hepatitis or you have HIV.
Yes.
So what will you do? You see? That will be a stress in your mind. And that was the wrong concept. You don't have to say that I don't have to go to hospital, because still if I find it out that I have hepatitis, what will I do? No, that's a very bad concept. Always get to know what you have in you, whether it's bad or a good thing. Get to know it. Get to know that you are healthy. So this is the most important advice I can give to our people who are listening and those who will get this afterward. It's very, very much important to make sure that you seek medical help even if you are complaining or not. Up to here, I will say thank you very much, and I always appreciate your idea and for coming up with this podcast, because this is, I see it's really helping our people a lot. There are people who are benefiting from this, because it's not one thing that you discuss from here. A lot of things, variety of things are always being discussed here by different people, and this is really helping so much. I believe, and I am very sure, if you keep this consistency, then definitely you will grow in 2 to 3 years. This will be a big thing, and you'll get some support from your fellow South Sudanese. I appreciate you, and hopefully next time I will be able to bring my fellow doctors who are also here in Egypt, and they also share the knowledge with you. Thank you very much.
Thank you, Brother Ngong. Bye-bye from now, and thank you for this. Bye-bye.
All right, yeah. Good day.
Thank you.
Okay.
So, guys, we come to the time that we are going to close up the program, and we thank Dr. Ngong for contributing and also putting all the information in regard to hepatitis and how hepatitis is deadly disease, and he also talked about medical symptom that you can see when you are suffering from hepatitis, and how hepatitis also a chronic disease that will also grow with you until you grow old. It will also grow with you and even die with you, of course, yes, because it is a deadly disease. And when you don't see it well, sometimes you may be suffering from some of the chronic diseases, and you will also die from it, because you have seen that it affects the liver, and it attacks the liver until the liver is dead, and automatically then you will not live. So you have heard what he says, and also in the context of the poverty in South Sudan, our country is crawling. We still don't have resources and all this, and that's why always we have people in the backgrounds, people in the rural areas. All these people, they need to be taught. They need also to be aware about this disease, because this disease is deadly. And if it is deadly, it needs a serious advice. It needs advice from people like Dr. Ngong, people like you. And that is one of the reasons that I also bring this professional and also people who have knowledge about the topic, so that they discuss what they want to say, because this is a platform, and this platform is belong to all South Sudanese. It doesn't mean it belongs to particular people, and so This platform belongs to all of us as a South Sudanese. And what you can do if you want to have any discussion with me, you can just text me on my messenger. Just text me on my, or you post a comment, okay, on my post on newsfeed. Then I'll just get that, and we will just have discussion. Because what you know, sometimes will also help other people around. It doesn't mean that we are going to be great people if we don't listen to each other. That is why, if you have time, if you arrange your time, you also need to text me so that we also have a discussion. This platform is open for any South Sudanese, and even any person who is willing to share his own idea is really welcome to Akol Podcast. The voice of innovation is here for you. The voice of innovations will always echo what you want to say to the people, and I think we are going to end today. And we shall start next time, next week, and if we have other guests that we want to discuss something. And it's really good enough for those who are studying in university to share their ideas, because these platforms, I'm also a teacher, and if I'm a teacher, I always like to invite students. This is what I love the most, so that we discuss some of the critical issues that we are going through in our country. And our country is suffering. Our country is really in a deep downhill, so we need to see it in our eyes. We need just to open up our eyes and see how this suffering is going to affect our people. Since we have seen this suffering from our people, it is upon us now to act and also advise some of our people to go for medical checkup, because some of the diseases, they need to be checked. Some of the diseases, they need to be treated earlier before they are not chronic, before they do not even reach a stage that is threatening the life. And it is necessary for us to advise our people, especially those who are in rural areas, so that they go for medical checkup. And to you, my followers, and everybody, and somebody who is saying this Akol Podcast, I really appreciate you, and I really thank you. Your support is what always make me to be like this. Without your support, without what you do to me, then I would have not reached this stage. This stage was brought by you. It was not brought by me. And I really love the support that I always get from you guys. This is the good thing, and I really appreciate each one of you. And I want you to keep it on. This is how we are going to change our country. And remember, if you want to have discussion with me, you just text me. Text me, and then we will have discussion. There is no problem. I will just invite you. We will arrange the time, and then we will have a discussions. It is free. You're not going to pay anything. Okay? You just buy your own Zol Kabir. You buy Ghanaian. You buy anything that you know is an internet, and then we go live. And also the final thing that I want to say is about the internet. I want to apologize to all of you if you see the video quality is poor. It doesn't mean that it's our failure, but it's a failure of internet infrastructure in South Sudan, because the technology is poor, and I'm always streaming in 2.5 down, 2.5 megabyte per second. This is the speed of the internet that I'm streaming sometime, and I make sure that the voice is hard, though video quality is low. Then I don't mind of that, but I want the voice, so that the voice should be heard by you. And that's why I always try to bring to you most of the guests from outside the country, and some of the guests are also from here as a South Sudan. And we need to apologize if the video content is really low. If you see also dropping in the frames of the video, so all these things is because of the internet, because the speed is really slow. And that is why you always say it like that. So from now, I have to say bye-bye to all the people around here, and we shall meet next time. And if you want any discussion like this, I want you just to text me, so that we have a discussions anytime that we have arranged. So thank you, and Akol Podcast is here to say goodbye to you, and bye-bye.